Baguette was found in 2000 here in Tucson, and it was designed to be for patients to empower themselves. As we know, knowledge is power, and finding information can be really challenging. Today, we really find that people still want printed materials in their hands. It helps individuals that might have a literacy challenge, a digital literacy challenge. A lot of the catchment area for the Cancer Center might not have all the immediate resources and needs that they do, and so the Baguette bag is perfect for those individuals. So when our founder Sheri had been a caregiver for her mother when she was diagnosed, and then a couple years later Sheri was diagnosed with cancer. And when she went to find information, you know, her doctor gave her 2 pieces of paper, and she had a lot of questions. She was a mother, she was a teacher. How do I tell my kids? How do I go about the next phases of living my life? And so she did a lot of research at that time, did a lot of that at the library. And so as she was pulling information together, she recognized that other people needed that same information. And so as she was coming out of it and being successful after her treatment, she wanted to do something to give back. She pulled it together, they put it in a bag, kind of like kindergarten packages that they would send home for the kids to read for the weekend. And that's kind of how it all sort of went into a bag and had that name of Baguette. I wanted to serve on the Cancer Center board because it was a great way to share what's happening in the community from an organizational perspective with the rest of the Cancer Center, and make sure that the voice of individuals were being heard, and that I could share what I'm hearing from patients and caregivers with the Cancer Center. In terms of a collaboration between Baguette and the Cancer Center, I think there are many ways that we can support one another. We're constantly trying to get the patient education materials into patients' hands, but finding who those patients are is tricky. So working with the Cancer Center so they can have those resources and share them directly with patients is super valuable to everyone involved. Baguette joined the advisory board in 2019. I think that was right around the beginning of it really stepping up to what it was going to be. And so we were fortunate to be there from the beginning and to continue to see that growth happen. Seeing more of the advisory board members really getting engaged and involved in all aspects of it and with the activities outside of our meetings has been really nice to just see that growth be able to happen and to see us be involved in what's going on. We just recently launched a Spanish bicultural bag that we're really excited about. It has both Spanish and English in one bag, but it also addresses a lot of the cultural components so that the Hispanic Latino community can really be more engaged and comfortable with that. So we're really excited about that bag, and I think it's perfect for the Cancer Center to be able to incorporating that with a lot of the individuals that they come into contact with. In addition, we've started some cancer-specific bags that are a great way to share those resources with patients so that patients are able to know what questions they should be asking, to have a better understanding of what's going on, to organize and record their materials so that when they go in for appointments, they're better prepared and better able to communicate with their doctor and share that information that's always being asked of them.